Hi everyone, today I'm going to explain about what is economic evaluations and how it is being applied in health technology assessment. Nowadays, with the constantly increasing in the cost of healthcare, people are concerned about how much budget can be allocated to the different type of disciplines and how many patients can actually benefit from the yearly healthcare budget. Now, put yourself in the shoe of policymakers. Before you making any decision, definitely you need to apply a certain disciplines of economics knowledge to the topics of healthcare. And definitely you are trying to figure out the ways to put value on the healthcare interventions, and you would like to identify the demand for the healthcare and the healthcare seeking behaviors. Therefore, you will be able to make a proper planning, budgeting, and the monitoring of healthcare with the informations that you will be having, and with the provided informations you can use it for the value-based medicines, and then you can plan further to get a universal healthcare coverage. You will be knowing how you can properly reimburse the healthcare with the limited resources, and you can advocate the policy decision making as well. Now, in order for the policymakers to have good decisions in how they allocate their resources to the healthcare, we need to do economic evaluations. Economic evaluations is to relate the costs and the benefits or the effectiveness in delivering the healthcare. Costing interventions is used to collect the cost data, and with the availability of the local cost data and local benefit or effectiveness in the healthcare, we can have a local economic evaluations, and it can be used to model the local healthcare situations. And if a good local economic evaluation is being done, we can also use that to project or to forecast the future needs for healthcare. Now, we have been talking about how we should allocate our resources to the healthcare. This is an example of the UK healthcare sector. In order to reimburse one cost of IVF that costs £3,300, you can actually use that funding also for one heart bypass operation, one half of a cochlear implant, 300 of MMR vaccinations, 9 cataract removals. This is all the opportunity cost that you can allocate for. As a policymakers, how are you going to decide which sector to be putting in for your funding? This is a great question for you to ponder. In this slide, I have listed out all types of economic evaluations that we can do. Basically, economic evaluations is looking into the cost and the outcome that we are looking into for that certain healthcare interventions. Cost consequences, looking into the description of the analysis for the consequences and the effect. Cost minimization, looking into the least costly option. And cost effectiveness analysis, looking into cost per unit of effectiveness. Cost utility analysis is to look into cost per additional quality adjusted life year gain. Cost benefit analysis is to convert all the costs and benefits in monetary value. Now bear with me, I'm going to explain each and any one in detail. Now, when we conduct cost consequences analysis, we are to sit down and list out all the resources that we have for that particular health interventions. This is a good examples that you can see when we have that different parameter, and we will be gathering the parameters for both the intervention A and the intervention B. Then when we have all the resources listed, we will look into the cost and the consequences that we are going to measure to compare these two interventions. Cost effectiveness analysis is for us to compare the cost and effectiveness in two different health interventions. We are using incremental cost effectiveness ratio as our comparison. For example, LAWA therapy compared to standard care, which is using hydrogel in the management of leg ulcer. From the cost effectiveness analysis, we know that LAWA therapy compared to hydrogel will have an incremental cost effectiveness ratio (ICER) of 40 pounds per ulcer free day. So the policymaker have to decide whether it's appropriate for you to use the LAWA therapy as compared to hydrogel for your treatment. Cost utility analysis is used to compare the different health interventions across the disciplines by using the tools that you can use to get the utility score from the patients. Now, with that particular analysis being done, policy or the decision makers can decide on the threshold range that are going to fund. This cost effectiveness plane is very helpful in interpreting the results of the cost effectiveness analysis. Now, when we comparing new interventions with the current treatments or the current interventions, if that particular new interventions is more effective and less costly, which fall under the SE quadrant, definitely we are going to use the new interventions. If the particular new treatment or new interventions is less effective and more costly, which fall into Northwest or the NW quadrants, definitely the new intervention is dominated, or we are definitely not going to use that particular new treatment. Now, what we need to decide is if the new technology is less costly and less effective, which fall into SW quadrant, or if the new technology is more effective and more costly, which is fall into NE quadrants. This we need to decide on the threshold or the willingness for us to fund the particular new treatment. Most of the time, we use economic modeling to model the current healthcare situations to decide on the cost and the effectiveness and the other resources that we need in considering implementing the new technology. And here are the different economic model we can do. Decisions tree modeling is the short-term modeling and one-off modeling. Macro models is to look into the long-term or the recurrence conditions. And definitely we are having other more advanced modeling like dynamic transition or discrete event simulations. So far, Matas has done a few economic evaluations, and all these evaluations are helpful in helping the decisions maker in making their decisions on certain policies. And you can download the particulars reports in our MOH website. Now here is the criteria checklist before you decide to send in your request for the economic evaluations. Number one, is local economic evaluations available? if there are already local economic evaluations being done, it's actually unnecessary for us to reinvent the wheel or redo the same local economic evaluation again. Number two, is evidence on effectiveness available? If we cannot prove that that particular intervention or the health technologies is effective, it is unnecessary to undergo economic evaluations as well. Number three, high burden of disease. Is the particular health interventions involve a lot of resources? This is the one that we're concerned when we put this in our criteria checklist. Number four, is this technology involving high cost? The high cost technologies will incur more resources to our healthcare system. Therefore, we need to do economic evaluation. And number five, is there any clear comparator or what kind of current practice that we are looking into? Number six, relevant local costs and resources data available. And bear in mind, if we do not have enough local cost data and we are then we have to use the resources from the literatures, and it might not be that suitable to be putting into our local condition. Number seven, is the particular health interventions feasible or suitable for us to develop economic modelings? Number eight, do the health interventions having strong implications to health policy or it will cause changes in clinical practice? And these are the checklist that our reviewers will sit together with the requester to decide whether the local economic evaluations is suitable to be conducted. These are the couples of the take-home messages that we would like to express during this short briefing on the economic evaluations. We know that the resource allocations is very important, and when we do our resource allocations, we need to consider all the costs and all the opportunity costs that we might need to put into our consideration before we make the resource allocation. We need to be very clear on what is our health interventions. First, is it really effective compared to current practice? And are we clear on the comparators? And what are the effects that it will bring? If only we are clear on these resources, then only we can do economic evaluations. And definitely, if you are undergoing clinical trials, please consider getting the inputs for economic evaluation as well. And bear in mind, economic evaluation modeling is the extrapolations of the cost and effectiveness beyond the trial data. And ICER can be used for the decision making reference. With this, I would like to say thank you.